Are we going to be meeting in person again soon or something?
I think it's possible by our next meeting, I think, right, in June. Unless it's going to be different for public facilities. I'm not sure.
I really like the Zoom meetings.
I guess we'll get all those questions answered today.
I don't know. I guess I'm one of a kind. I kind of like the Zoom, but
It is become like it's like part of the norm, you know.
Well, the nice thing is if I have a coughing fit, I can just mute and I'm not interrupting anything.
Yeah.
Yeah, I've been telling everyone who asks that we have a long agenda today, so the COVID stuff's at the very end.
Okay, well, you're just kidding, right?
Yeah, no. No, it's actually going to go a little bit quicker than expected because 2 things got solved before we even logged in today.
Okay. I got Jim calling me right now. I wonder if he's having trouble.
He's logged in though.
I just saw him.
Looks like we're having some technical difficulties with.
Yeah, he's having some problems. We see him. He just can't get the volume.
Well, if you put him on speaker, we can probably hear it.
He just asked if you could send him the email again.
Sure.
Should I open the meeting or we live? Okay. Yeah, we'll just go live, but we see you. Okay.
The link is sent again.
Yeah. I'll call the meeting to order. Good afternoon, everybody. This is the Thursday, May 20th, 2021, 3 o'clock Board of Health meeting. And pursuant to the Governor's March 12, 2020 order suspending certain provisions of the open meeting law, any Nantucket public body that holds a meeting will do so via Zoom video conferencing. The video conference will be shown on Nantucket's Government TV YouTube page. It allows for the public to participate in the meeting as an attendee. Attendees must register to participate. The registration link is unique to the meeting. The registration link can be found in the description of the Nantucket Government TV YouTube feed for the meeting. People registering to be an attendee must use their names, otherwise they will not be allowed to participate in the discussion. Attendees will join in listening mode. They can click the raise hand button if they wish to speak. The chair will call on those who have raised their hands in order they were raised. If you do not have an audio capable device, a Q&A button can be used to type a question. The YouTube chat will no longer be enabled. Any questions that cannot verbally be asked must use the Q&A function. All these questions should be directed through the chair. And just a reminder that this meeting is being recorded by video and audio. I will do, let's see, a roll call for attendees for the meeting. As I see you, Malcolm McNabb,
Present.
Meredith Lepre,
Here.
Jim Cooper. We see him. Give a thumbs up.
He's muted.
I know he's having problems with his audio. We also have Dawn Hill-Holgate sitting in today, but Dawn just won't be able to vote on anything of the agenda. Dawn's here. Art Crowley, Assistant Director.
Here.
John Hedden, Inspector.
Here.
Kathy LaFave, Inspector.
Present.
So, any public comment? Is there anything on the agenda that the public would like to talk about that is not listed?
We don't have any hands raised, so we should be good.
Okay, so we'll move right into the next thing on the agenda. Approval of the minutes from April 15th and April 30th, 2021.
So moved.
Okay, can I get a second?
Second.
Okay, by roll call vote, Malcolm McNabb,
Yes.
Meredith Lepre,
Yes.
Jim Cooper, can't see him. And Chair Steve Visco says yes. Okay, next up, we have a loan for the Turk family on 15 Marsh Hawk, which is a septic to sewer loan.
Yes, so this is just same thing, straightforward. Sewer has been available, so as required by Regulation 69, they asked the loan so that they can connect to the sewer. No objections from our end.
Any questions from the board? All good? Or? Okay, I get a motion to approve the loan for 15 Marsh Hawk Way.
So moved.
Can I get a second? All in favor by roll call, Malcolm McNabb,
Yes.
Meredith Lepre, I saw your mouth move. Yes. Jim Cooper, can you hear us now, Jim?
I think
No, Steve Visco, chair says yes, so that passes. Okay, lift of condemnation order for 36 Essex Road.
yes, so 36 Essex Road, we actually condemned a long time ago. It has recently changed hands, and the new owner has been working diligently to get it fixed. And the violations that made it condemnable no longer exist. There's still some work being done on the property, but our inspectors believe that it can be lifted at this point.
Anybody have any questions about 36 Essex? Meredith?
I just don't know what goes into condemning a building, so I was just curious.
Yeah, so what originally ended up happening, we did it on human habitation, so not for structural issues. When we did that inspection, I want to say it was 2018, maybe 2019, early 2019. What ended up happening was windows were broken. There was no proper drainage. The doors were blocked. There was the heating wasn't working. So things were a little rough, and we ended up just doing an emergency condemnation at the time because so that we can get the inhabitants out, because at that point they were in danger. And then it basically lied fallow for a few years, and then the new owner has been really diligent in picking it up and fixing it. So we just have to vote to lift it and allow it to be occupied again.
Great, thank you.
Thanks. Could we get a motion to lift the condemnation order?
Yeah, we can't hear Jim. Jim, can you click on the microphone and switch over to phone audio? It'll give you a phone number that you can call, and we can do it that way. Anyway, sorry, Steve.
I move for the motion. So moved.
A second.
Second,
All in favor by roll call vote. Matthew McNabb,
Yes.
Lepre,
yes.
and Steve Visco says yes. Okay, next we have, it's on there, but I'll let you talk about it for a second here, Roberto. Appeal of the correction letter, exposed septic tank 36 Mass Ave.
So at the time when the septic system, when we had originally issued an order on this house, erosion at the road out there on Mass Ave, the septic system was up to the water line. It was getting hit by waves every once in a while during storms. And then since the order was issued, that beach has accreted, and the danger is no longer in place there. So we can live. We were thinking of just lifting it internally, so that we don't have to worry about the appeal, and the violations don't exist anymore. So we don't even need to vote on it.
So we don't really need to take any action on this?
We don't need to take action on it anymore. The violations no longer exist.
Okay, thanks. Next, allow a 6-month extension of the septic to sewer connection due to COVID-19.
So yes, this was originally a discussion, so to see if we can add, for people who couldn't line contractors up so that they can get their septic to sewer done during COVID, because COVID really kind of messed up, especially when we did the building moratorium. However, between the time that we put it on the agenda to now, we received, and I forwarded to the board the opinions of town council that the governor had actually passed an order that extended all permits to the lost time to the end of the what's that word? The state of emergency. So there was a particular permit that I sent to you in an email that was brought up. So for example, if the permit expired on March 20th of 2019, or he pulled the permit on March 20th of 2019, and it would have expired on 2021, because of COVID, the declaration of emergency, all permits have a stay of execution. They are all extended to that extra time that would have been caused. So in our case, let's say the permit that expired on January of 2021 now would expire on January of 2022, because that's the difference in the state of emergency time-wise. We'll have to do it case-by-case basis, but we can actually do it internally, so it no longer requires a vote. So I know I wasn't clear on that. It's pretty convoluted process. But if you have an active septic to sewer permit, it is still active and you do have an extension, just give us a call for the specifics on that, and we'll go from there.
So we don't need to take a vote or any action either on this one.
No, that was done automatically by the government.
Yeah,
Emergency.
right. Yeah, so that was, yeah. Okay. Yeah, I guess we'll go right to your COVID-19 update and the emergency order discussion.
Yes, so on Monday the 17th, Governor Baker mentioned that all the emergency orders from the state side will be lifted on May 29th, and then the state of emergency will be lifted on June 15th. We have our emergency orders in place. So what it really comes down to is we're now faced with the question of, do we lift all of our emergency orders also effective May 29th, or do we want to leave them in place until June 15th? Either way, they all expire by June 15th because the governor is lifting the state of emergency. All of our orders were based on the state of emergency. So what I would recommend is align with the state on May 29th. The only emergency order to keep in place would be the one we used for outdoor dining. That way we can maximize the amount of time that the outdoor dining one is still there. But with that, we're winding down.
What does, maybe, could you explain maybe like the 15th, like what does that actually mean? I mean, I know I've been getting a lot of questions from people.
Yes, so what the governor is trying to do is that on May 29th, he's lifting all the emergency orders, which basically reopens everything. But he was leaving the state of emergency in place. The state of emergency, by declaring the state of emergency by the level of the governor, it gives him a specific authority to be able to enact emergency orders in order to protect public health or public safety, things like that. But when that threat to safety no longer exists, he is required to lift the state of emergency. It was originally going to be done on August 1st. And through that declaration of emergency, we were able to enact certain rules and regulations, things like requiring the mask wearing, but also things that allowed for the expansion of premises for the ABCC, so the restaurants can actually set out outdoor dining. That was all done through emergency orders. So what this would do, by him removing the declaration of emergency, that authority is no longer valid. That authority does not exist past June 15th. So in order to pass regulations, something like if we want to continue mask wearing, we need to do it as a regulation, as a Board of Health regulation, which would require, in our case, in Nantucket, 3 weeks of advertising plus a public hearing and then an implementation date, which is pretty onerous. In cities, it has to go as a city ordinance. It wouldn't just be able to be done as through the Boston Public Health Commission, for example. So it adds that layer of process that is not there during the declaration of emergency. And the other parts are, another part of the declaration of emergency is Section 31A, Chapter 111, Section 31A gives the Board of Health to pass what's called a reasonable public health regulation. Under a declaration of emergency, that definition gets a little blurred. So what some people consider reasonable, other people don't. So it allows the governor actually to give that authority to make those decisions for regulations without having to pass what's called the reasonable test. So all that is being lifted on June 15th.
Mm.
Anybody want to comment? Go ahead, Malcolm.
I thought I understood it. Now I'm a little confused. However, I think we have to be really careful here. There's been we've done a great job on the island. Things are going good. But my experience is usually when you get overconfident, when you start thinking things are going well, that's exactly when things crash and go south. We certainly can't have someone standing at the boats and the airports checking everyone's vaccine card. And so I would strongly recommend that somehow, through all the complexities of the law, we continue masking inside at least for a while. I think we really need to do that. I just get very nervous when we all say, "Oh, things are getting better. Things are going to be great." We still have to be vigilant. This disease hasn't gone away yet.
Isn't in the governor's orders, public transit, certain things will still have to
Yes.
order inside?
Even though he's lifting almost everything on the 29th, everything that goes down to the federally regulated things all still have to wear masks. So transit, unfortunately for Paula, she needs to maintain masks. Hospitals, nursing homes, and certain other locations still have to wear masks indoors.
Does that include, let's say, Steamship Authority, who's part of the federal highway system?
I don't believe so. I do believe so. I mean, but thank you, Don.
Yeah, it said ferries.
Yeah, because of the federal regulation there.
Meredith, did you have your hand?
Yeah, so does that mean June 15th, it goes back to what life was like in February 2020?
Yeah,
Feels like the governor sort of, somebody offered him some money to make these decisions, because I think that it sort of, I think everyone, all of the businesses had been planning on what we had been told, and now everything's going to open up the floodgates and let anything happen, and it's just gonna, and we don't, I think, have enough people to even control the crowds or control anything. I mean, I'm a little concerned that I don't think there's anything we can do. I think because come June 15th, everything's going to be open. I mean, does that mean they don't have to wear masks on June 16th on the ferry?
I think if there's a federal regulation in place that they have to follow, yes. But every business is allowed to set their own regulation too. The only thing is we can't force anyone, for lack of a better word.
I'm just concerned that the floodgates are going to open June 16th. Well, probably before then, and all of a sudden, all of these businesses that had been preparing for a certain amount this summer, a certain amount of traffic, a certain number of people at a time, are now, it's going to be like the floodgates and people dancing on bars, and there's not a lot we can do about it. But that's just my concern, is that things are just going to go crazy because everyone's been sitting in their house for a year.
I still think, I think you'll see a lot of people still wearing masks. Nobody says that you don't have to
Correct.
not wear it. I know I will, traveling for sure.
And it's also still required on planes. That's part of that federal requirement. We do have two comments, two hands.
Okay.
So, Amy, you're up.
Hi, thank you. I just had a quick question. So if things lift through the state rules, so we go the 29th for what's supposed to happen on the 29th, and then the state of emergency ending on the 15th of June, does the town have the ability to implement a mask order after the state emergency has been lifted? Like, is there rules and bylaws that you guys can put in place that would require that to still happen indoors?
Not under any emergency order, no. We would have to do a full write a full regulation, do public hearings, do the whole things. But even then, I would suggest against it because of that. What would be considered reasonable? I don't know if that would be held up in court if it gets challenged. But I'm not.
I'm full on support of the lift on the 29th and the emergency ending on the 15th. But, you know, everybody still has a right to, and I respect people's rights to wear them after. But I was just curious if there was something you guys could put in place that would continue that. And I understand it will be hard and take a while. So, but thank you for your time and thank you for everything you guys have done. I really appreciate it.
Thank you, Amy. And then one other one. Rose, you're. Rose, you can talk.
Oh, I'm sorry. Hi, my name is Rosella McCaig, and I live full-time on the island, and I'm also an attorney. It feels like we're tippy-toeing around what, to me, is going to be a dangerous situation. Well, first of all, it's May 29th, where we go back to quote unquote normalcy. It means there's no more 6 feet separation. So for example, if I go to the gym, I'm fully vaccinated. Thank you to Nantucket Cottage Hospital. I go to the gym and the gym doesn't have to have 6 feet apart in the machines. Somebody walks in, they say, oh, I'm vaccinated. They take off their mask. They've been exposed to COVID. I think that the CDC started off on a bad note by saying unvaccinated people can go around without masks. Then everybody started saying they don't want to wear a mask. I agree very much with Meredith that somebody gave Governor Baker some money to do this, this economic pressure to do it. I don't think it's safe to do it. I don't think it's safe in Massachusetts, but I especially don't think it's safe on the island. You know, we have, I've been looking at the numbers, and it's wonderful that we've got almost 10,000 people who've had their first dose, and we've got about 8,000 who've had their second dose, but we have about a 17,000, year-round population, but doesn't that swell to almost 50,000 in the summer? And that doesn't count for people having house guests. It doesn't count for all the people who are living under the radar. We have a huge population in the summer. So really what's 9,000 people being vaccinated is a very small percentage. We can't control who comes over. And we're dropping the masks. We're dropping the 6-foot requirement in restaurants. We're letting everything come into full capacity. And I think that the ramifications is going to be terrible. I think we'll be back to where we were 15 months ago because there's no control whatsoever. I think as an island, we should do everything we can through the court system or whatever we need to do to get whatever orders we have in place. I think Governor Baker has put a huge burden on our businesses by making them enforce it. If it's one thing, are we telling all of our business to show vaccine cards? What business is going to do that? Our restaurants can open at full capacity with no 6-foot distancing and no masks, basically. I think it's great. I want our restaurants to make money. I want our gyms to make money. I want our stores to make money. I own a home here, invest in the island. But I also see a disaster coming, and I don't understand why we're tippy-toeing around this. Am I the only one who sees this as a problem?
Malcolm?
I'm sorry. So again, excuse me, I go back to where I started. I think we should do what we can, even if it's burdensome, to get a mask order for people inside, period. That's something we can do. And I know, Roberto, it may be difficult, but I think we have an obligation. Excuse me, I'm sorry. We have an obligation to the community to do what we can to make them safe. And the other regulations, that's something I think we need to do, period. Or we can just have everyone, as I said before, stand at the boats and the ferries and at every business, and you can't come in unless you have your vaccination card. And that's crazy. We need to have the masks inside.
So there's a couple things there. So we all, let's not, we're talking about that was mentioned earlier, tippy-toeing around something. One of the biggest parts about this is Nantucket is not cheap to go visit and to live in. It is incredibly expensive to come here and to have houses to come here. And those who are able to come here in the summer, who have seasonal houses here and to have seasonal rentals here, are among the most affluent in the United States. The most affluent members of the United States are more likely to have been vaccinated than almost any other population in the United States. Their vaccination rates are closer to around 70 to 80%. So even, yes, we have had 9,000 vaccinations here, and that is not the 35,000, 40,000 people that get here in a given day on a summer. But it is also, it's not looking at all of the information there. At least 50% of the people coming here in the summer, that excess 20,000 people that come here in the summer, will be vaccinated. So in a population of 50,000 people in the summer, if there's an excess, or 40,000 people in the summer, we have the 10,000 here that are vaccinated, and the 10,000 of those coming in. That's 20,000 people vaccinated of a 40,000 person population at the minimum. That is enough to start mitigation. It's not enough for herd immunity. That is still we're still probably never going to reach herd immunity. But it's important that we also have to learn to live with this virus. It's here to stay. And if we consistently roll back just because we've had a few cases, then we'll never move out of the COVID shadow. And I think, honestly, I think that we should mirror the governor's orders and let the work that we're doing speak for itself. If we go through the whole regulatory process just to pass a regulation that won't be even effective or even available until July, at the minimum, based on our own charter on how to pass regulations, it'll be really hard to put that cat back in the bag.
Go ahead, Malcolm.
Through all of this, Roberto, I've agreed with most 99% of what you recommended, and you've done a great job. I still have concerns. I mean, you say 3 weeks to have an announcement of a public hearing. Well, 3 weeks is a week less than our next meeting, which is 4 weeks from now, which is a little after June 15th. And yes, there'll be a lot of people vaccinated, affluent people. But what's the vaccine rate of, say, people under 30? We have all those 30-year-olds that are going to come here, and as Mary said, are going to dance on the bars, are going to dance on the beach. They're going to come here to party, to have a good time, to get together, to have lots of interaction. That's what young people do. And I don't know what the numbers of young people vaccination rate is, but it's certainly not as high as the affluent people that are older. And I'm just very concerned. It's like, we've done so well in this island. We've worked hard, and like all of a sudden, oh, everything's fine. Even with the governor, whatever he says, everything's fine. Let's just go forward. Let's have a good time. And we need to gradually get ourselves back until we really know about this virus. And I agree, this virus was going to be here forever. It's going to be like the flu virus. But let us not go too fast. yet.
Dawn, go ahead.
Mind if I say something? I think this is happening faster than we all anticipated. I'm not completely surprised, but I was a little bit surprised at the timing. And I know that it's going to be very scary for a lot of people, sort of unwinding from what we've done for the past year and a half. But I do agree with Roberto. I think that that we need to align with the governor. I think it's going to create a lot of confusion if we try to bring in a new regulation. I think that that people will gradually ease themselves out of this with their comfort level. I think that that we will find that many of the people coming here are vaccinated. People constantly tell me that they're vaccinated. They're very proud. People are very proud to be vaccinated. Yeah, some other states have already lifted. I know that most businesses are still requiring people to wear masks on their own and following protocols that they feel comfortable with. Our restaurants are not going to have any more capacity than they currently have, even though they could have more of it indoors. Yeah, I'm very nervous about having really strong reasoning behind why Nantucket would be different than the rest of the state and then in other states that are unwinding this. And if we go all the way back to the beginning, we initiated these all of these regulations and all of these emergency orders to not overwhelm the hospitals. No one ever thought that we could completely eradicate COVID-19. And that we have to learn how to live with it and move forward. And I'm just very, very leery about the Board of Health taking an action to institute a regulation that will be different than everywhere else in Massachusetts and probably everywhere else in the country as other places move forward with dropping their emergency orders. And I would just be very cautious about it and really have some strong reasonings. I would also be worried that you would have a legal challenge and that people wouldn't listen.
That's the other.
Well, I also agree with Malcolm. I think, there's a lesson here of those who don't know history are bound to repeat it. And I think of the Spanish flu of 1918 pandemic went on for longer than what we've been going through. And the places that opened up didn't do as well. So, I mean, I don't think it's that big of a deal to ask people to wear a mask inside. They're doing it now. And no, we might not be able to police it all, but at least we can plan that most people would choose to do the right thing. Because I think of all of those affluent people that are getting the vaccine, there is a whole nother subset that are anti-vaxxers. I see that all the time. So, those anti-vaxxers are coming here and are going to be very happy to just say that they have the vaccine. So I just don't think that it's that big of a deal for us to say you have to wear a mask inside when you're here. They have to wear one on the ferry on the way over. And I just, we have to also protect our local people and, saying all of the visitors that are coming and they can just willy-nilly not wear masks is not really fair to our community. That's just my opinion. So I think from a medical perspective, it would be smarter to try and have masks indoors. I think a lot of businesses are going to want to require it anyway. So we would just be helping them out.
Anybody else?
We have another hand up again. So.
Okay. Go ahead, Rose.
Thank you. I strongly agree with Meredith and Malcolm. I think that two wrongs don't make a right. I think Governor Baker is absolutely wrong. And I think for Nantucket, we are very different. We're a tiny, tiny island with not a lot of space to move around in. We don't have enormous restaurants and enormous gyms and enormous stores where people can naturally socially distant. We're all packed in. And I think that that increases the risk. We have a small hospital, with no ICU, but even if things don't get that bad and people are in the hospital, even that, but I think to rely on the fact that the people, that second homeowners, I used to be a second homeowner until I moved here, full time. And I've really learned a great deal. The island looks very different when you live here than when you just come as a vacationer. So I've experienced, both. And my fellow second homeowners, when I was one of them, I noticed a lot of entitlement among that group. And now that I live here full time and I look on the Nantucket Year-Round Facebook page, I do see a lot of anti-vaxxers. I do see a lot of people who maybe, sort of politically, voted for Biden and all that. But the mentality is still freedom, freedom, freedom. And as a lawyer, I find it really interesting how all of a sudden we've got an island full of constitutional lawyers and HIPAA experts, whereas people don't understand the Constitution, they don't understand HIPAA. And there is absolutely nothing wrong with having businesses require that people wear masks inside unless they want to produce a vaccine card. They don't want to produce a vaccine card, then they have to put a mask on. But you can't come into a business without a mask on. And the problem with letting each business police itself is that we're putting a burden on our businesses who have already suffered a great deal. We're making them police the public. And we're making them say, well, you can't come in without a mask. Well, the CDC says I don't need a mask, or well, I this, or well, I that. We're really burdening our businesses, burdening our restaurants, our stores, our gyms, burdening them all by making them police the public. If the town does it, then it's a town regulation, and whatever burden or hoops that we have to jump through to get that done, I think is better for the community and better for the businesses. Governor Baker did what he did. I don't think it was right. And I thoroughly agree. I think it was economic and it was pressure from other states, or somebody gave him money to do it, or something happened. But it was not in Massachusetts' best interest. He made a turnaround within a couple of days. There's all the CDC said was it was safe for people who were fully vaccinated to go about indoor and outdoor without a mask. That's all the CDC said. They didn't say open up. They didn't say people without vaccines could go without masks. They didn't say no more social distancing. All they said was, if you've been fully vaccinated, you're safe to do these things. And states extrapolated from that what was good for them. And I think for Nantucket to follow a little respect blindly along, at least let's keep it till the 15th. Those 2 weeks mean something. Let's not do it on the 29th. I think we need to have some guts here to protect our community. People who've made investments, who do live here, whether they own or they rent, and people that work here, people that have retired here, whatever, we're all contributing to the community, and the community should protect us. I know I'm doing my part. I've stayed safe, this entire year. Fortunately, I'm in a profession that allowed me to do that. Massachusetts court system has protected all of us, the judges, the attorneys. So I'm very lucky. But as a whole, I've also believed that keeping the masks on, staying socially distant, doing our parts, that's what we need to do. And if it's a little burdensome, we still have to do it. I don't agree with just saying, oh, well, let's just follow the governor because it's going to be easier. I really agree with Malcolm's concerns and Meredith's concerns wholeheartedly. Thank you.
So while we were here as well. I pulled up the state vaccination rate, and what we are finding is that among those 30 to 49, there's a 78% vaccination rate per capita in the state of Massachusetts, and 20 to 29 so far, it's been 53%. So it is not bad. It's not the best, but surprisingly, the 20 to 29-year-olds are getting it at a higher rate than we expected. So it's an average of 53% vaccination rate in 20 to 29-year-olds.
Anybody else? I mean, this is just a discussion, and we're still under the. We're not taking any vote today. I mean, and I'm personally myself, I'm gonna, follow my epidemiologist that I'm looking at right there, and I would side more with Roberto. And I don't believe the governor was bribed to do anything. He's surrounded by public health officials who he takes guidance from this whole time. So I don't believe that for a second. So it's somebody that really shouldn't even accuse him of something like that. So, I mean, that's how I feel. I'd just rather stay with the governor's order, and, I believe other states had the vaccination also. So it wasn't just Nantucket. Everybody that's coming here is getting vaccinated.
Yeah.
Malcolm?
Well, like I say, I made my point, and I have all respect for the governor, and I have respect for his advisors, and I have enormous respect for our own health officer here, who's really pulled us through all this. But I haven't changed my mind. And if I made a motion that would ask the staff to prepare a regulation, I'm not sure it would pass the people here right now. I know there'd be 2 votes, but I'm not sure about the rest.
It would also we would need to write it. It would need to go to town council review. It's not, I can't just get a regulation posted tomorrow.
I understand, but I'm feeling frustrated here because I think like all of a sudden everything's fine. I mean, that's just crazy. It's just, we've worked hard. This island that's done well. You look at the numbers for the last week, it's fabulous. And all of a sudden everything's fine. And that just bothers me. I feel like we should do something more. I need some help here.
Meredith?
I mean, last I checked, Governor Baker does not have a public health degree or a medical degree. So I agree with Malcolm. I just think that this was done too fast. And I feel like he's putting us all in a really bad position for whatever reason that he was. I think that if he hadn't done this, everything would be fine and continue as it was supposed to. But he's put us in a bad position. Because we have to, it would be a lot of work to get to be able to make a regulation that everyone has to mask, correct? It would be, didn't you say we'd have to have to do a town regulation?
Mm-hmm. It would have to be a full regulation, and honestly, I would recommend against it. And also, yes, Baker does not have a degree in public health. He does not. But Monica Burrell does. Jana Ferguson does. Mary Lou Sutters does. Rochelle Walensky at the CDC does. So and we're not saying that everything's okay. And that's not what we're saying at all. And what I'm trying to recommend here is that give it a chance. I think, honestly, if things really get bad, the declaration of emergency will happen again.
Well, the problem is when things get bad, Mr. Chairman, is that they get bad quickly.
Yes.
You know, Roberta's always showed those beautiful little, how the disease spreads from 1 to 2 and then doubles exponentially. So if it does happen again, it's going to happen fast. It's not going to happen slowly. And can we react fast enough? Can the state react fast enough? If we have an outbreak on Nantucket and they don't have one in the rest of the state, will the state implement something for Nantucket? I'd feel more comfortable if I knew that would happen. Of course, I don't feel comfortable at all the fact that they were going to wait for something bad to happen.
Meredith?
Can I make a motion to keep the mask order indoors in place until June 15th? Or is that not, can we do that? Because then we'd have an idea. I mean, that's a month away, right? We could see where we are at that point. And it may be that everything is fine. I mean, it may be that more people than we thought were vaccinated and things are okay, but that gives us a little time to protect our community, especially when everyone is coming and bringing their germs.
It's up to the board.
Oh, well, Mr. Chairman.
Yes, go ahead.
If we can do that, I would support that. I would support leaving it in as long as we can. And if by all the, you tried to explain to us at the beginning the regulations, the laws, and it got a little confusing for me. I'm just a simple doc from upstate New York. I don't, not much in the law, but so.
Can you hear us, Jim? I'm a little uncomfortable not having a full board of just making a decision to the 15th right now. Jimmy can't hear us and we're missing one member.
We would have to post a new meeting if we push it back.
Oh, poor Jimmy.
Just a second, let me send a message. Just a moment. Jim, I'm sending you a phone number. Call that phone number, and I'll put you on speaker here. Jim, can you call that phone number that's in your email right now? Oh, there's Melissa. Or Steve, if you can also text me Jim's number and I'll call him from my. Melissa, can you hear us?
Hi, Roberto. Yeah, I can.
Hi, Melissa.
Sorry to be late.
So we were just talking about the emergency orders for the governor. We're talking about either keeping them in place until June 15th, possibly asking town council to help us draft any sort of regulations for the summer, and then we're trying to solve a audio issue with Jim.
Okay. Okay.
And
Roberto, could you remind me of what your recommendation is? I'm sorry that I'm late to the meeting.
Yes, so my recommendation would be to rescind the emergency orders so that we can mirror the governor's order. We're having a discussion about whether that is the best course of action. So I have to call Mr. Cooper so that we can get him on the speakerphone. But in the meantime, if you would like to put your recommendations or your discussions, please do so. I'm going to mute for a few seconds.
Go ahead, Melissa.
Well, I don't necessarily know that I have an opinion yet. I guess I'd love to hear from board members who have been talking about it. What are your feelings?
Well, Meredith, why don't you just give her a little review of what you've said?
So Malcolm and I both feel like the order should stay in place, that we should have masks inside. And I recommended, could we just keep the mask order until at least June 15th when the emergency order ends, to see how things are. And maybe things will continue to be great and wonderful and it will be less of an issue, but I'm uncomfortable just opening everything up for a multitude of reasons. From a medical perspective, I think it puts us in a hard place because there's going to be so many people coming. And I think our businesses have not prepared for that because they were not prepared to have as many people as probably are going to be here. So I think it really would be better for us to have masks indoors until at least June 15th.
I have Jim here, so go ahead.
I've missed most of this stuff, so I don't really know who's for and who's against. So are we at a point now where we have to vote on something? Because, you know, I don't think I really have enough information where I can't read lips and I couldn't hear most of it.
So what it really comes down to is that what we're finding into is that we're at the point of voting for opening or maintaining the emergency orders in place or not maintaining the emergency orders in place. The argument has made on both sides, whether that the argument was made that opening up is putting a little bit too much of a burden and that we don't know enough information yet to really move forward. I'm making the recommendation that we should probably continue with the governor's order and then lift our orders on May 29th. I think Meredith is waiting to do a motion, is the word that I was looking for, is looking to make a motion to keep the orders in place until June 15th.
Can we make a motion and put something in effect immediately? Is that what you're talking about?
Correct. We can make an motion, put something in effect immediately, but that would, as far as an emergency order goes, it would only stay in effect until June 15th because the governor is lifting the state of emergency. What Dr. McNabb and Ms. Lepre are looking to do is to also ask that we start drafting a regulation to require masks after the state of emergency is lifted.
Well, what if we just see what's going on and then we can always change our mind, can't we? We can always make that, decision if something goes wrong or something changes in the meantime, can't we? Or what do you recommend?
I recommend lifting the emergency orders.
Which will be the 29th.
The 29th, correct.
Just so June knows.
You want to keep it in effect until June 15th?
At the minimum, yes.
This is Melissa. Is it a safety? Can you tell me a little bit more, Malcolm and Mary, about what your specific concerns are about not having indoor masks?
Malcolm?
Well, oh, my concern is that we don't know who's vaccinated. We really don't know how many people are vaccinated. We're going to have a lot of people coming from a lot of other states where we don't know what the vaccination rate is. Like I said, we can't have people checking vaccine cards at the ferry. We can't have stores checking vaccine cards when they enter. I see no harm in extending this to June 15th. You're talking about another 2 weeks from when it would automatically disappear. And for us to extend it beyond that, Roberta was telling us would be very complicated, and we may have to do that. I don't know if you want to add anything, Meredith.
Well, let me ask you a question. What happens when people get off the boat and everybody that's here assumes that everything's lifted and they start going into restaurants, into stores and everything, and all of a sudden they're not allowed in there? And they're under the assumption that, you know, everything's been lifted. They don't have a mask and they think everything is all right. What are we going to do? What are the people that are running these businesses going to do? They have to tell them they can't come in? They have to go out and get a mask?
That's what the requirement would be.
Well, how is that going to happen? How do you know that's not going to happen?
The enforceability of it is difficult, to say the least.
Well, Malcolm, I mean, I understand what you want to say, but how would you police that? How would you have these people that running restaurants and retail stores and everything? What are they supposed to tell these people? I'm sorry, you don't have a mask, you can't come in.
Well,
how is that going to work?
Well, Mr. Chairman, to go on to Mr. Cooper's question, I mean, again, the ferries, the planes can still have announcements that you still have to wear a mask on Nantucket indoors. A lot of establishments offer masks for people if they don't have them. And I think most people, even though you no longer have to wear a mask outside, you see a lot of people around with masks. I don't think that's not our issue. Our issue is public health here. We're essentially saying, by not extending the 15th, this board and this town is telling everyone everything's fine. We can be lax, we can be happy. I think there's a message too to be sent here that if you still have to wear a mask to June 15th, is helping to educate the community that this virus is still here and this virus will be here for a long time. I think our responsibility to this board is for the public health of this island, period. And one way we can help is extend it to June 15th. I'd like to do more, but I get the sense that's all we really can do. That's my opinion. It's not going to change.
Well, let me ask you a question. What happens is June 15th? Is that automatically going to be everything's okay now? Or I mean, what is June 15th going to say to us? By wearing the mask for 2 more weeks, then after 2 more weeks, everything is okay? No one has to wear a mask? Or what happens? Do we still come back and say, maybe we ought to do it another 2 weeks? I mean, are you saying that by June 15th, then we're going to say everything is all right and no masks are needed anymore? Is that what you suggest?
I'm not suggesting that. I'm suggesting that this virus is going to be here forever. And like people have said, we have to learn how to live with it. But I'm not sure just all of a sudden opening everything up now is the right thing to do. On June 15th, who knows what's going to happen? But it's extending the time. It's giving us a little more time. It's giving us a little more time to see what's happening in the world, what's happening in Nantucket, what's happening in the state. We need, I've said it all. I have nothing more to say. I would like to proceed with Meredith's motion and see what how the vote comes out. I
And-
think we've discussed this enough.
And let's not forget, there are cases of people who have been vaccinated getting COVID. So, I mean, I think that extending it for as long as we can, June 15th is just when the governor is letting all the floodgates open, and there's not a lot we can do to continue the mask order, or it will be extremely time consuming, it sounds like, and difficult. So if we can get it till June 15th, I think we should go till June 15th. So I stick with my motion.
I second that motion.
Oh, I'm sorry, Mary.
Yeah.
Was that a motion that was made and seconded?
I made a motion earlier to extend the orders until June 15th.
Okay, and that is now on the table, made and seconded.
Yes.
Okay, may I have a little bit more discussion on this motion, Mr. Chair?
Yes.
Roberto, having heard these concerns, through you, Steve, to Roberto, having heard the concerns of Meredith and Malcolm, you still stand behind your recommendation. What is the public health risk to the community lifting the mask order now versus on June 15th, from your perspective?
The difference in those 2 weeks is at the most another 500 vaccines. The vaccination rate has started to slow down significantly. So the difference is less than 10% of our total vaccinations so far. As far as the public health risk goes, the public health risk was always a matter of the personal responsibility. Yes, we're getting people who have COVID, who have had the vaccine getting infected with COVID again with breakthrough cases or variants. But in all of those cases so far, none of them have ended up hospitalized, which, as Ms. Holdgate brought up earlier, the whole point for the emergency orders was to prevent the overwhelming of the hospital, which in the last 16 months, what we have really come to find out is we know how to treat it. We have specific therapeutics on how to treat it, and the vaccines are preventing most hospitalizations. So what it comes down to is, in my recommendations to open up on May 29th, is more because the extra 2 weeks will only have a minimal increase in the mitigation of risk.
And is there continued, I'm sorry, Steve, if I could follow up on that.
Oh, yeah, go ahead.
I apologize. Thank you. Is there any further protection? I'm thinking indoors. Private businesses would still be able to choose whether or not they would require masks. And where would masks be automatically required? And where would they not be if we were in alignment with the state?
The only places that would automatically be required to have face masks are transportation, which includes the ferries so far. What would be the next one? Hospitals, nursing homes. That includes, and the transportation also includes the buses. And then any private business that requests or requires it within the bounds of their business.
Okay, and what about schools?
The DESI guidance, I think I would have to look at it again, but we can, Kathy has it and Don has it.
Early childhood and K-12 public also required.
Okay. So the indoor masks would be required in schools, on transportation, planes, boats, buses, while people are traveling to the island. Hospitals and private businesses could choose to enact a mask order if they felt it was for their safety or the safety of their patrons.
I believe so, yes. Any business is allowed to request or require masks within their business.
Okay, and taxis, presumably you would
Yes.
need to wear a mask in there.
Yes,
Okay,
or the transportation.
thank you.
Thanks.
Let me ask one question. Maybe I'm a little confused, Roberta. So retail stores will have an option, even though if we pass this to April 15th, will it between now and the 15th, will they have an option to, yes, you have to wear a mask, or no, you don't have to?
No, if we keep it if we keep it in place through the 15th, they would have no option. They would have to require it.
Okay.
Okay, so the motion on the table was to extend the governor, our mask order past the governor's 29th to the June 15th, and has been seconded, I believe, by Malcolm. So all in favor of extending it, the mask order to the June 15th? All in favor by, if you're in favor by roll call vote. And I'll start with Malcolm McNabb,
Yes.
Jim Cooper,
No.
Melissa Murphy,
No,
Meredith Lappery,
Yes.
and Steve Bisco, chair, says no. So that doesn't pass. We'll be sticking with the governor's orders.
The orders are still in place. We would need an order to rescind the local, we would need a vote to rescind the local orders.
so you would need one of us to make a motion to rescind the local emergency orders to align with the state of Massachusetts orders.
Correct.
Okay, I'd make that motion.
James just seconded it.
Okay, all in favor by roll call vote, Melissa Murphy,
Aye.
James Cooper,
Aye.
Malcolm McNabb,
No.
Meredith Lepre,
No.
Steve Bisco, chair, says aye. So we looked at, then we're in line with the 29th. Correct?
Correct.
Steve, may I ask a question through you to Roberto? Will there be continued outreach and communication about this that we can provide, obviously, transportation organizations? I just feel like we need some succinct messaging that goes out about where masks are required in the state, because we do have a lot of national and international visitors.
Absolutely. Just because the state of emergency is lifted, like I said yesterday at the select board, just because the state of emergency is lifted doesn't mean it's over. We will be continuing all our outreach and education. We're going to be posting the vaccination rates monthly starting next month. We will also be posting cases monthly starting next month too. So we're still going to continue monitoring all the COVID situation, and we will still continue vaccinating. We are actively reaching out to groups to get people vaccinated as much as possible. We held a vaccine clinic yesterday at the Saltmarsh Center in the evening, where we vaccinated almost 20 people. And on Friday, Heather went to Atlantic Landscaping. Thank you to Mr. Congleton for that. And we were able to vaccinate, I believe, 18 people on Friday. So the outreach is working, and it is getting to the population that we weren't expecting. That was getting a little bit harder to reach. Sunny Daly was able to get a group of people vaccinated at Health Imperatives. So we will be continuing all the outreach and education as much as possible. It's not over.
No. Yeah, thank you. I feel like that is the fear and the concern, and that the unwinding from these emergency orders and feeling safe is I really respect Malcolm and Meredith's opinion, though I didn't agree with it, but I understand the concerns. And I guess if you could just explain to us also what the process would be if we did start to see COVID cases increasing after the state of emergency is lifted, what actions can this board or can the community take at that point, and how would we proceed with those?
Without a second declaration of emergency, we don't really have the ability to do so. At that point, it would still be the education and outreach. And even if we do have a regulation, even if we do write a regulation, it still would be almost impossible to enforce. So we would find ourselves in a very similar situation to where we were last winter, which, when you think about it though, we did have the lowest infection rate in the state from the winter through to fall.
Meredith, did you have your hand up before?
Yeah, I'm just with all of the mobile units. Are those things getting updated to like MIIS so that people have access to that information?
Yes, we update Heather. She's been phenomenal. She updates everything to MIIS the same day that she issues the doses.
Any other comments?
Thank you, Steve. I just have one last question. Roberto, I know you've typically shared this at the select board meetings, and if you did it last night, I don't remember it. What is the vaccination rate now like for our non-white community? How are those rates going?
It is going better. I actually just had it open. I was using it for the age groups. For some reason, it's about, there it is. For Nantucket, we are at least one dose per capita. We have reached up to 49% of the Black community and around 70% of the Hispanic community, according to the census. So we need to cut that down by about 30% within those respective communities. So I would say around 36%, 38% of the Black community on Nantucket, and about 45% to 50% of the Hispanic community.
That's a market improvement even over a week ago, if I'm not mistaken.
It is. It is.
Mm-hmm.
Primarily the last 70 doses or so that we've issued through the town and through health imperatives have been primarily in the Hispanic community.
Great. Great.
Meredith?
Is it the J&J that you're giving, or are you giving?
It was both. Through the town, we've been issuing yesterday's drive up, and the ones that we've been doing with the town have all been J&J. I believe Health Imperatives is doing Pfizer. ACT Dental Arts will be doing Pfizer as well. Dan's Pharmacy is doing Moderna. And then the hospital is helping us coordinate Pfizer across the board as we can. And then starting May 31st, we will be able to order our own Pfizer as well.
Okay, any other questions for Roberto?
Yeah, I'm sorry. I just have one more. Roberto, there's no residency requirements to receive the vaccine. So even if somebody was visiting and hadn't been vaccinated yet, they would be able to have access to the vaccines?
Correct. All we need is a name, last name, and date of birth.
Great, thank you.
Any other concerns from the board? Any other questions?
I guess if I could just make a comment, I do want to thank Roberto and his staff and this board for your dedication and commitment to the health and well-being of our community. I know that we've had not always seen eye to eye, but I think we've collectively done the best job possible under very scary circumstances to take care of each other in our community. And I just want to say thank you. It's been an honor to be a part of it with you all. And I know it's not over yet, but it does feel like a marked time in history that we're even having these conversations about not wearing masks and our vaccination rate being stronger. So thank you to Roberto and your team.
Thank you, Melissa.
And so, is that it? Any other questions, comments? Can I get a motion to adjourn then?
So moved.
A second?
Second.
All in favor by roll call vote, Meredith Lepre,
Yes.
Jim Cooper,
Yes.
Malcolm McNabb,
Yes.
Melissa Murphy,
Bye.
and Steve Visco says aye. Thanks, everyone.
Thank you.
Thank you.